So a lot of patients come in for consultations and they hear about Invisalign and they want to know more about it, what it does. So I'll just start from scratch as far as if you're a candidate for Invisalign, we can tell that from the photos and the x-ray we take, and most patients are these days. A lot of things that braces can do, Invisalign can do as well. What we would do is we would take a mold when you are ready to commit to changing your smile, and that mold is going to be sent to Invisalign. Now, whoever you use to work with Invisalign, whether it's another dentist, another orthodontist, you're not going to get the same exact Invisalign back, because what happens is the dentist or the orthodontist will treatment plan with Invisalign and decide what order you're going to move your teeth, how many aligners you're going to need, just the sequence of events. So it's going to be a little bit different depending on who you go to. What happens is we get all of the aligners back that you'll need or that we think you'll need. So most cases, let's say you need 22 aligners. We have you wear each aligner for about 2 weeks each. When you come into our practice, we usually give you about 3 aligners at a time. That way you can change them on your own every 2 weeks, and we don't have to see you for about 6 weeks. Now, if things start moving along really well, we might even not need to see you for about 8 weeks. If things look like we really want to keep an eye on something, we might see you even in 4 or 5 weeks. So we just keep an eye on things and we decide the speed to go. You'll get the aligners in a little baggie, and we'll write down the date, and usually what we say is change your aligner at night. The reason why is because you're going to take them in and out during the day to eat, to brush your teeth. When you change to a new aligner, sometimes your teeth are a little sore for a couple days, and so by changing them at night, you can sleep in them and not have to worry about taking them in and out. This is just an example of an aligner. It's very clear. Some of the aligners have these little blue dots. We typically put these on for the Invisalign teen patients. What happens is the blue dots fade over time, so we can tell if a patient is being compliant with it. You want to wear your aligners for about 22 hours a day. You really should only drink water with them. If you're going to sneak anything, you might be able to use a straw, but we don't recommend that because anything can seep underneath this aligner and create a problem with your teeth. Even if it's a diet soda, it has acid on it, especially anything with sugar could create a cavity. You also don't want to use your aligners for like bleaching trays. Your teeth are going to be going through orthodontics, so they'll probably be a little sore, but these aligners aren't meant for that. The bleach can squeeze up into your gums and hurt your gums. I'm going to show you an example of a patient who did Invisalign. She was a great patient, and basically the first step we have is showing you her clincheck. So this is a really cool cartoon, and if you look at the lower here, you can see there's 28 aligners. The 28 aligners, we're just saying, maybe that's about 56 weeks or about a year of treatment. So each little notch shows what happens in 2 weeks. So if I slowly go this way, I can see how her teeth are changing, and we know which teeth are going to be changing at which time. If we look at just the upper arch, we can see how that changes. So she did have a little bit more correction on her upper than her lower, so she didn't need as many aligners on her lower. The nice thing that we can do now is, say if you're done with one arch before the other arch, we can give you kind of dummy aligners, so they're not actually moving your teeth, but they're ones that you just get a nice new fresh aligner in 2 weeks while your other arch is still moving. I'll show you some pictures of this patient. So her main complaint was that these laterals stuck out. And you can see it more from the side. And throughout treatment, she actually got engaged and she got married, so she was complete with her Invisalign pretty much by the time she had her wedding. What we did is we completed her to the aligner stage that we showed you, and then we decided, you know what, it looks really great, but we want to just get a little bit more movement. So included, sorry about that, included in your Invisalign is something called a refinement, and what the refinement does is we just do a few more aligners just to get everything perfected. So, after your first set, if you're just seeing that one tooth is being really stubborn or that you want to change something a little bit more, we can do that. So on her refinement, she only needed 6 more, and that just perfected things a little bit more for her. You can see how slight the movement is, but if something's in your mouth and it's bothering you, that slight movement really makes a difference. Another thing that the aligners, not the aligners, but the teeth might have something called attachments. So don't worry, they're not bright orange. They're tooth colored, so they look like little bumps. And the reason why we have to put some on is just to get the most movement we can achieve on, you know, certain cases. You might have some that are just on your back, you might have some just on your front, and we can decide at what point of your treatment that you need them. So you might not need them the whole year and a half or however long your Invisalign is. So that's Invisalign for you. I know that a lot of patients come in here, and once they hear that spiel, they kind of get, you know, a bigger picture of their options for it. But you can always come in and ask us any specific questions, and we're just really happy with the results we're seeing.